I want to wish everyone a happy and safe Memorial Day weekend. All of Illinois appears to be on track to move into Phase 3 of Restore Illinois next Friday, allowing hundreds of thousands of Illinoisans to go back to work in the industries that are eligible to reopen in the weeks ahead. Safety is of utmost importance, and we're working with industry associations and businesses, employees, and doctors to make sure that we set strong health compliance standards to keep everyone safe. But we can't have a conversation about going back to work without talking about childcare. If we don't have childcare, a large portion of the workforce, especially women who too often bear a disproportionate burden, will be without any way to move forward without caring for their child themselves. From the start of this public health emergency, Illinois has recognized the importance of childcare for working families. We focused especially on essential workers continuing to work outside of the home. And for that reason, we included childcare in the list of essential businesses, starting with our first stay-at-home order. And over 2,500 childcare homes and 700 centers have been providing care over the past few months. That's about 15% of the previous operating capacity of our childcare system. When I issued the stay-at-home order, we implemented an emergency childcare system that provided access to childcare in small group settings for essential workers, people who ensure our public safety and help others, families to get food, gas, pharmacy goods that they need. And I'm particularly proud that Illinois made sure that all essential workers, from nurses and doctors to grocery store clerks and food producers, were eligible for the state's Child Care Assistance Program, meaning the state covered most, if not all, of the cost of child care for our emergency child care providers and for the essential workers who use them. And to help keep emergency child care centers up and running, the state offered a one-time stipend and paid enhanced reimbursement rates for emergency child care for 30% above what we usually pay to reflect the additional costs of providing care in smaller settings. In sum, we've been focused on supporting essential workers and protecting the health of children and child care staff. And I'm pleased to say that this approach has proven successful. To date, Illinois has not seen significant transmission of COVID-19 in child care settings, which is encouraging evidence that child care can be provided safely. Public health experts emphasize, however, that there is much that we still don't know about this new virus, how it spreads, and especially what effects it has on children. Therefore, moving forward, Illinois must take a cautious approach that appropriately balances the need to greatly expand childcare with the need to lessen the risk of spreading coronavirus. We gathered input from over 80 stakeholders from all around the state, including child care providers, child care resource and referral agency staff, legislators, advocates, state agency officials, and of course, public health experts on everything from new health and sanitation protocols to staff training needs to what supports families will need as they return to childcare. Their insights are reflected in the plan that my administration is issuing today, shaping our roadmap for safely increasing access to childcare as parents return to work. Following the guidance, all of the 5,500 child care providers who are not currently operating are being asked to reopen when their community moves into Phase 3 of the Restore Illinois plan. For the first 4 weeks that they're open, providers will be able to serve no more than 10 children per classroom. Once they have provided care safely for 4 weeks and have gotten accustomed to the new health, social distancing, and sanitation routines, they will be able to expand to larger group sizes, though not yet their fully licensed capacity. On the strong advice of public health experts, these new group size limits will be roughly 30% lower than the levels they were at before the pandemic. For our licensed homes, which tend to be smaller, most will be able to operate at standard capacity. With all centers and homes online, this would bring us to more than 3/4 of our previous child care landscape in Illinois. Providers that have been successfully operating as emergency child care providers can move immediately to these new maximum capacities when their region enters phase 3. Most licensed child care homes will also be able to reopen to their licensed capacity. Recognizing children's need for quality early learning experiences, all providers will be expected to resume compliance with all licensing standards related to curriculum, learning environment, and staff qualifications. Already, we've made significant investments in maintaining Illinois' vast child care network during this crisis, implementing a simple waiver process to allow providers to be paid for all of their enrolled children in the Child Care Assistance Program for March through June, so that child care staff could continue to be paid as normal through this unprecedented period. And for emergency centers, we increased the CCAP money that providers would get for each child. But there is more to be done, and we are working on developing appropriate business relief funds that will help to minimize the impact of these necessary restrictions. That is work that we're already doing at the state level with the help of CARES Act dollars. But it's crucial that the United States Congress amplifies its support for our national child care landscape in an upcoming relief package. It doesn't matter whether it's a red state or a blue state. Every state is home to providers who need real assistance in sustaining their business through the coming months. And every child in every state deserves access to quality child care and early learning services. We all want a stronger, more equitable America on the other side of this pandemic, and it starts with our children and their earliest experiences. This is how we begin to build that post-COVID world. Now, before I take questions, I want to take a moment to offer additional insight into some of the changes coming in phase 3 of Restore Illinois, which it looks like will be 1 week from today. In the coming days, my administration will be releasing specific industry reopening safety guidelines that combine public health expertise with the creativity of our people to find a way forward. Similarly, my team and I have received a lot of excellent proposals and ideas from different religious groups on how to safely expand their services. Let me address that specifically. From a broad standpoint, I can say that outdoor faith services, including but not limited to drive-in church services, will be welcome in phase 3. And we continue to collaborate with faith leaders to ensure that they can hold services in safe and creative ways that allow for worship while protecting their congregants. I know worship is as essential as food and water for most of us, and it's my priority to provide guidance to ensure that it can proceed safely.